Do you have a child with autism or a toddler showing signs, and you're looking for an autism daycare or a special needs daycare or just an inclusive daycare that is going to welcome your child and do a good job? Today, we're talking about when a child, uh, are there prerequisites? Is there a certain profile of a child that should not go to daycare? What's the difference between, say, a full-time ABA program and daycare, or a combination of different therapy programs and daycare? Today, we're going to get into the top questions on all of those issues. I have Kelsey General here with the top questions she's going to ask me. So let's get to this very important topic of autism daycare. Welcome back to the Turn Autism Around podcast. I'm your host, Dr. Mary Barbera, and I have Kelsey General here. She is our community manager. Kelsey has two kids on the spectrum, and she has been with us first as a student learning our course materials way back in 2016, and she's been with me ever since. So welcome to the show, Kelsey.
Thanks
Yeah.
for having me, Mary. It's really nice to be here and talk about daycares. My
Yeah.
kids have both been in daycare off and on um, in different settings, so it's a really important topic.
Yeah, and Kelsey and I have done a lot of these top question episodes before. So we're gonna jump into the first question in a second, but let me just kind of get on some of my soapboxes, or the big things we should look at before we dive into the specific top questions. So I think in general, if you're talking about a child who's already diagnosed with autism, or even a child who probably is going to get a diagnosis, they may be having a lot of trouble in their current setting, in their daycare settings. And a lot of times for families, daycare is an absolute must, or some kind of child care is an absolute must. So, a couple things to consider is that if your child has a lot of delays, that is going to be consideration if they are two, but they're not talking at all, or they're not drinking out of an open cup, and they're not able to really wait in line or sit in circle time. Those can all certainly be factors, and that might, you know, impact the acceptance of the child in their normal ratio, or maybe even if the child could go with a therapist or with an aide that could be provided depending where you are in the world. But if you're in the United States, therapy, early intervention therapy is oftentimes provided, and that can go to the home, or those professionals who are, have a lot of expertise can go push in into the classroom. In some states, you can get therapists to go in, registered behavior technicians, or um, TSS are called in my state of Pennsylvania, but it really does vary. So that could help with, reinforcement during circle time and keeping the child busy and engaged. The other big factor is if a child is exhibiting any kind of major problem behaviors like aggression or self-injurious behavior, um, or elopement from the classroom or from the playground. Those are all bigger bigger issues usually, that even if the child can be supported with an aid, a lot of times a regular daycare situation cannot handle those sorts of issues safely, because they not only have to worry about your child and the safety and the progress of your child, but they certainly have to worry about the entire classroom of kids and aides and teachers. So, but don't think that even if right now your child can't tolerate a classroom setting, that that's going to be forever, that this level of autism and problem behaviors has to be, an ongoing issue. So I've developed, after 25 years in the autism world, the BECA assessment. It stands for the Barbera Early Childhood Assessment and gives you scores in three areas: self-care and activities of daily living like eating, sleeping, potty, grooming, and dressing. It'll give you a score in language and learning skills, and it'll give you a third score in problem behaviors. It really does line up well with standardized speech testing and the VB map, but it can be done without any materials in as little as 10 minutes. That can be done by a parent or with help of a professional at marybarbera.com/assessment. Now, that's not going to tell you, oh, well, they scored 50 in all three areas. That doesn't really tell you whether or not they can go to daycare, but it certainly is the first step to kind of get a big picture of their strengths and needs to see, to give you a starting point for how you can help them increase their strength, decrease their problem behaviors, and have them able to be, eventually included in more typical settings. So there are autism daycare and special needs daycare specifically, not around my area. I think there are some sporadically throughout the United States, but in general, I think today's topic, we're going to talk about regular daycare with private pay. There are also things like Head Start and preschools, and then there's special needs um, preschools that have different organizations providing those. So, what we're going to talk about in the how to find a good classroom setting and how it doesn't really matter. I know we've done another episode, which we can link in the show notes, on should you do, home or school ABA programming. This is going to be more specific to daycare situations, but a lot of times with, especially for kids with a diagnosis of autism, they are oftentimes merged together. So, Kelsey, do you have anything to add before we get into our first question?
Yeah, I mean, I think you said it well. Daycare, is often suggested as a first step when parents start noticing delays. Oh, just put them in daycare. It might help with social skills, it might help with language. And I think that's why it's important to do something like the Becca, because if you look at that and just the language score is low, but you actually don't have problem behaviors and you have good self-care, it might be a great fit. If you have a kid who's low in all three areas, the likelihood is without a lot of support, you're not going to probably see a ton of success. And so we're going to go over how to look for good placements, because some families don't have the luxury to just keep kids home. I mean, they need to work. And so it's a really important topic and a complex one, but I think we do really need to do an assessment to look at what's going to be possible. So let's get into those. And
Okay.
our first question that a lot of people ask is, okay, I've decided we're ready. I want to give this a try. What should I look for in an autism-friendly daycare?
It's a great question. I think if that daycare has worked with other children on the spectrum, that's a good sign. You could call the director. You could describe your child, uh, whether they have a diagnosis or not, or their delays, and see if you can see if they have openings. A lot of times you have to get kind of into the application program months before placement. So you might have to sign up in January or February for the following fall well, that's more for preschools. For daycares, though, a lot of times there's a wait as well, at least around my area. So you might want to start looking at it even before you think you need it, if at all possible. And I would meet with the director in person if you can. And I would probably not bring your child along just because you'll be distracted and the director may be looking at your child in terms of, if they have any problem behaviors. And meanwhile, you're talking and you need to concentrate. So um, see if you can get an idea of whether the teachers and the assistants and the director are willing to accept training, accept a speech pathologist who's coming in from early intervention, whether they're willing, and maybe they have history of working with a physical therapist or occupational therapist that can come in. Just they don't need any special master's degree, PhDs. They just need a willingness to accept a child um, into their daycare who may have some differences, that sort of thing. Also, I would look at how they communicate with families in general. Um, I would ask them and look for how they treat problem behaviors. Biting, I'll tell you, I've done video blogs and podcasts on biting, and biting is the kind of thing that is very serious as a registered nurse. I know how that human bites are even more dangerous than animal bites. And that usually that does, you know, require a written write-up, a notification of the child who bit, and the child who has been bitten, or the adult. A lot of times medical evaluations, like all kinds of things. So if you, like I said in the beginning, if your child is biting, you or their siblings, I don't think I would try daycare until you learn how to get positive reinforcement going, get the child to stop biting. But just in general, are they using timeouts? Are they taking away toys when there's a little disruption in things? We want to have a positive environment. Um, and overall, just if you can observe for 5 or 10 minutes, just see. I use this example sometimes when I speak live to live crowds, is that if you were just going to pick between daycare A and daycare B, and you went into daycare A and you heard teachers saying, "That's it, I told you to stand in line, you know, Johnny, keep your hands to yourself. Now we have to put the toy away because you guys are arguing over it." Those are all negative, negative, negative. Whereas in daycare B, you go and Amy, I like the way you shared your toy. Oh, that's awesome. You stayed in line. High five. Those are all positive. And so we really want to pick the environment, the teacher, the aides, the director, the daycare that has 8 positives to every negative, which is a Glenn Latham kind of strategy that I really use everywhere I go. So that's how to look for an autism-friendly daycare.
Yeah, and um, one thing I'll add to that is actually a story of my middle son, Lincoln, who does not require a lot of support, but he does have autism. And he was at a small family daycare with 8 other multi-age kids. It was a really good fit for him, but I thought since now he was 4, we should move him to a bigger center, more of a preschool setting. But it was still a daycare. And he got in, and I was reading the handbook. And in the handbook was a discipline section. And it said there is zero tolerance for hitting or taking another child's toy, and there will be an immediate call to the parents and all this stuff. And I read that and I thought, this is probably not going to be a place that's going to be accepting of a child who may not always have positive behavior unless there's someone right there, who may be quick to give a hit if he's not supported right. That's not a very accepting program. And their discipline was not in line with what I would have done, which is prevent the hitting if you know a child is more prone. And when I asked them, like, what supports are in place so that these things don't happen, they didn't have a good answer. And I immediately knew that that was not going to be a good fit, even though he didn't have high support needs. It was just not a fit for us. And I think those are really important things to know your child, know what they're prone to do, when they're prone to do it, and what kind of supports are in place to prevent those types of issues.
Yeah, I think that's an excellent point.
Our next question is, will daycare provide my child with autism social opportunities? I really want to put them in daycare so that they can increase their social skills. Is that a good idea?
Again, it depends on the child's level of functioning in terms of language, in terms of problem behaviors, in terms of play skills, imitation skills. They're not just going to get the skills by an osmosis. So in chapter 7 of Turn Autism Around is all about social and play skills. And I talk about, my son Lucas, who when he was little, he went to typical preschool, um, 2 mornings a week. And really, I mean, daycare preschool, when you're two, it kind of, looks pretty similar. And he did pretty well. But he went for a whole year without support before his diagnosis of autism the day before he was 3, and then he stayed back in the 2-year-old preschool. So, in terms of social opportunities, since he was a young 2 and a young 3, his birthday's in the summer. So he got to his initial preschool spot, toddler preschool program, when he was just after he turned 2, and many of the kids turned 3 right in the fall who missed the cutoff. But Lucas was already functioning at like a 12-month-old level for language or a 9-month-old level for language. So he was already really delayed in terms of language and social skills and imitation. And so the kids that were turning 3 were so much more ahead. So when in general, it's not the end of the world if you say, oh, my child turned 3, but they didn't progress to the next daycare classroom, because they're not potty trained or whatever the criteria is. But really, you have to think about not just their actual chronologic age, you need to think about their developmental age. So sometimes being with younger kids is more appropriate, not just for these milestone skills like drinking out of an open cup or potty training, but also for the social skills and the imitation. Um, the other big factor is I did have a child that I consulted with because I'm also, as you know, a behavior analyst if you've listened to the show before. And so this little boy was going to 4 days a week to a special needs preschool program, um, all day. And they had every Friday off. And so mom thought she would put her child in this daycare setting, which the child's typical brother went to in the on Fridays only for social opportunities. So I went as a consultant in there when I was evaluating this child, and it was like a huge birthday party. I mean, there were 30 kids running around. The ages were like 3 to 5. This little boy was very delayed, was not talking at all. It didn't have even, touch the banana or where's the cat. Looked really lost. And at one point didn't have any support person with them. So I was just observing, trying to just stay in the background, not provide support because I was doing an evaluation to see if this was appropriate. And I turned around and I turned back, and this child was literally licking the wall. And of course, I jumped right up and got the child away from the wall. But, you know, the whole day, no one was there to support this child. So that's just like it's a very sad, and I don't, situation where a child is, you're paying for this daycare opportunity, you want this socialization to happen, but if they're not ready with the prerequisite skills, they have no imitation skills, no language skills, they have problem behaviors, they're not going to benefit. So when Lucas repeated the second year of the toddler program, when he had just turned 3, and also went with one of his ABA therapists, we were able to work on some of the skills that he would need. It was called priming. We were able to, okay, in circle time, they sing this, 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 or they are using scissors and crafts. So let's work on this within home ABA therapy. So really, for social opportunities, we send in a big bin of games and toys that the therapist could get the bin out during free play time. And the little kids loved that because his therapist was then another adult in the room. The teachers and the aides loved it because during free play time, it was like having another well-trained adult in the room a couple of the kids could then play with Lucas. So there's definitely ways to increase social opportunities, even if your child is not at the other kids' levels. But we really have to be careful about not just saying I'm putting them in daycare for social opportunities if they're not ready.
Yeah, and I'll say that comes back to picking the right daycare. Are you going to a daycare, that is willing to provide those social opportunities, because they don't often just magically happen for our kids. They need to be facilitated. You know, if if teacher Susie knows that Johnny likes puzzles, is she going to know that maybe if I bring this child close to Johnny with a puzzle, this is going to be positive? And not all daycares have the capacity for that, or you might need to send a support worker to make sure that that kind of interaction can happen, or else just putting a child in daycare without the right supports, you'll have kids taking their toys, you'll have kids, and fights occurring, and that could actually put social skills backwards. So it's important to have the right level of support. And both Brentley, my oldest, has always had a one-to-one at any daycare program. And it's not until this year at 10 that he has shown any interest in his social peers. And so it can take some time, even when they've been in programs for years with support. So our next day question is, how can I prepare my child with autism for a daycare program or a typical, program?
Yeah, so I do think that with my approach, whether we call it the Barbera method, the turn autism around approach, or the verbal behavior approach, we have a 4-step procedure. One is assessment, and that Becca assessment is really critical. We also do other assessments like language samples and assessments on any actual problem behaviors a child has, assessments on feeding skills, and all kinds of things. So we need to assess the child, the whole child. We need to assess the actual daycare, and when you have found a good daycare, then we need to prep it just like we would prep for getting a haircut if that wasn't the most fun thing for the child, or going to the grocery store with success. So our courses, our memberships, we have step-by-step procedures. But a couple of the procedures I would use is then I would take the child to the class. Some children need to go to the classroom without any kids in it, just to meet the teacher and the assistant. And then as you're there, maybe you could take an aide with you if the child's going to go with an aide, or you could go with both parents, or a parent and a grandparent, so that one adult can chat with the teachers, another adult can keep a close eye on the child to support them. Even if they're going to go alone, it's important that we don't have a bad episode because you're distracted and trying to support your child and also speak with the teachers. At that point, hopefully with two adults and the child there, we could take pictures of the teacher, the aide, if they agree to that. We can take pictures of the classroom. We can take pictures of the outside of the building. We can take pictures of the playground. We can maybe have the child be able to play on the playground. Maybe we could take a video of walking in the door, walking to the classroom, and we can either make a picture book or a video model of how it's going to go. For some kids, they're able to go in with the parent or two parents while the class is in session, and maybe they can participate in snack time or craft time or playground time for a short 10, 15 minutes. And you could also take videos and pictures. It depends really on the level of awareness that the child has and their capabilities to participate or not that first little session. And then I would make sure you review what's going to happen, and there might even be situations where you could support your child maybe for the first hour that they're there, or a half a day, or you could bring them in for a 2 hour session and you could support them and make sure that they're able to be independent. Um, and those those are some of the ways. I mean, I know, and Kelsey knows well, um, that a lot of times we have to teach skills more systematically on a one-to-one basis before we can um, send a child into a classroom setting. So we could practice fake circle time. We can read books to our child and ask them questions. We could have them sit on I've done this in homes where I have the child with autism and a sibling or two, or the therapist pretends they're the child. They sit on placemats on the rug while I read them a book and ask them questions. And so they can see kind of how that goes. Oh, we're going to have circle time. I'm going to have to sit. I'm going to have to answer questions. Um, so practicing skills, whether that's before daycare even starts, or if daycare starts and they say, okay, well, this part of daycare went well and this part, but we need the child needs to improve in this area. We can pull that skill out and practice it at home.
Yeah, you pretty much covered everything that I would say on that topic. I mean, I think we really need to teach skills. One thing that I've talked to Mary about before is it's a lot easier to build an instructional relationship with a child through table time, which you teach in the courses, through structured learning. So if at all possible, if they are going to have a one-to-one, have that one-to-one come a couple times even to the house or to the playground at the school, and just pair with your child, get ready for that situation. Teach basic following instructions, basic requesting things they want, like water or food. Those are all things that can help. And safety skills are really the top things to help keep your child safe and successful, would be the things I would say. But everyone's prepared, everyone's ready to go. We've decided our next question is how to handle dropping my child off to daycare, especially if they're crying.
Yeah, so this is where practicing, maybe you can show them the book and the videos. Maybe you can even practice going to the school and playing on the playground when after school is over. Anything to pair the area. Also, just in general, we don't want kids, screaming at time of drop off. I was lucky because Lucas and Spencer, my typical son, they never had separation anxiety when I dropped them off. In Lucas's case, I think he was just kind of oblivious to the situation initially, and then he would be dropped off with his therapist at the same time, and it was never a problem. Although the other 2 year olds a lot of them did have separation anxiety. Um, a lot of times we have to use reinforcement or, um, identify maybe on the tour, like, oh, they have Thomas trains here, or they have a dollhouse that the child really liked. Maybe take a picture of that and say, when you go in, you're going to be able to play with the dollhouse or with the trains, and make arrangements with the teacher. Maybe you don't have to. I know during COVID time, it was really crazy where, masks, teachers in masks would just pull the child out of the car. You weren't allowed to even get out. And I think that's all traumatic. So if you can like go in, maybe you could even get there 15 minutes early or 10 minutes early, and you could go in with the child to get the dollhouse going or the Thomas the Train, and then don't sneak off. Say to the child, I'm gonna go, I'm gonna be back. When we're done, when you have a good day, we can get XYZ. We can go to a playground, we can have a special drink, we can have a special snack. Um, and there may be a couple tears when you leave, hopefully not, but um, we can also practice at home. Like some kids really have severe separation anxiety to the point where you can't even leave the room easily. So that's a whole pairing and process, which we have helped some of our members within our online course and community. I also want to let professionals know, whether you're an early intervention professional or an ABA, verbal behavior professional that supports kids and deals with separation anxiety, is I really want professionals to learn my approach because it's positive, it's child friendly. We just started a brand new verbal behavior pro membership. Um, we might be on a wait list by the time this show airs, but you can always email us at info@marybarbera.com and we'll let you know whether the VB Pro membership is open and you can join us there. But I think it's super important, not just for parents to handle this, is for professionals to learn the best way to teach all of these important skills and to reduce problem behaviors, including separation anxiety.
Yeah, and I think that'll bring us to our last question, which is how do I advocate for the needed supports at daycare, whether you're a parent or professional? Because you might even be a professional seeing your client going into a daycare without needed supports.
Yeah. And a lot of times it comes down to, a child not being supported and biting somebody or having some kind of disciplinary action. And we did do a blog on getting kicked out or held back from preschool or daycare, which we can link in the show notes. But I think in general, um, know that if your child has an IEP, if they have a diagnosis of autism, if they have a diagnosis of developmental delay, we need to work with the professionals within that system, um, to discuss how to get your child into the best placement possible with the needed supports. Um, like I said at the beginning of the show, if your child is having extreme problem behaviors or major problem behaviors, it might not be the best situation for anybody to for them to be in typical daycare. But that doesn't mean they shouldn't get the needed supports they need and the needed placement. Sometimes that requires getting an advocate. It really depends on where you are in the country and if you're international. But, you know, work directly with the professionals, put things in writing. So if your child goes to, especially a special needs setting where they do have an IEP and they do have, say, a one-to-one support aide with them, and you found out that they ran out of the recess yard and it was a major safety issue, whatever, something like that comes up, um or your child is on the receiving end of being bitten or that sort of thing. Um, I would put that in writing and not just over the phone. What they said, what you said, that you feel that they have a one-to-one, that during recess time, that one-to-one should be within arm's distance, or they need to be within the fenced-in area for recess, or whatever the situation is. We need to not just verbally talk about it, but put it in writing, even an email, documenting the course of action that's going to keep our child as safe, as independent, and as happy as possible, and really look at the whole child um, and know that this is when they're 2 or 3 or 5 or um, this this isn't the end. This is just keeping them very safe and in a supportive environment at this point. This doesn't mean that you have a crystal ball that this is going to be forever. So I would say, we have advocacy, we have an advocacy bonus video. I talk a lot about that within my courses and membership. And the same goes for professionals who know that a child needs more support. Um, I would say working collaboratively with the parent can really make a difference. And with funding shortages and, staffing shortages, we can't expect the moon, but we can expect moving forward to support each child to our best potential. So that's really what I have. I would really encourage all parents and professionals to dig in to, at least start reading the first 2 chapters for free at turnautismaround.com of my newest book, Turn Autism Around. Also to dive into the courses or membership for parents and professionals, because this is just a small slice, picking an autism daycare, but we have lots of topics, and I think we have just a really great positive community with Kelsey here as our community manager. Kelsey, do you have anything else to say about advocating for supports?
Um, Not really, besides join your local mom autism group, find out what supports are available. I know in my area, like I said, Brentley has had a support in daycares and after school programs since he was 2. And that is actually paid for by our local, what's called supported child development. And they provide one-to-one so kids can be in inclusive settings. And you might have something like that near you. Making sure you're taking data and seeing where the problems are, and then going to funding sources and asking, is there one-to-ones that can help support my child, especially if you need to work and need your child in a type of setting like that. And really just pairing with people, trying to understand where they're coming from and being direct about what you need, but also understanding the limitations of certain programs.
And Kelsey is in Canada.
Yes.
So, they have a different funding structure, but like everywhere you go is the general principles that we just talked about: 8 positives to every negative, pairing, reinforcement, providing enough support, not putting a child into a situation where they're not going to be successful, and just learning how to navigate the waters and become the captain of the ship, which I talk about in Turn Autism Around. So hopefully this gave you a glimpse of some of the top questions about autism daycare. Same applies for toddlers showing signs of autism, or and with any other disability or disorder like Down syndrome or genetic abnormality. These are real issues affecting real families. So we hope that these questions and answers helped you in some way. If they did, we would love to hear about it. Just leave us a comment, email us, and let's move forward. So thank you so much, Kelsey, and I'll see you next time.